Yes, my name is Afolakemi, and welcome to another edition of PSL Talk Show. And with me is my co-host Adebola. The topic we are about to discuss is one dear to my heart and some of our audience, and it's about relocation and specifically migrating through the healthcare visa, or probably if you're a nurse and you're looking to relocate to a developed country like the UK. And today we have Toby, Ireti, and we also have Pelumi, and definitely our beautiful guest, Nurse Deo. So as a bit of intro, the UK immigration statistics in the past year have actually reported that about 239,987 work-related visas have been granted, including dependents of those people that have been granted. So this is deduced to have increased by 110%. Based on 2020 statistics and 25% higher than 2019. So it has been also been reported that the new skilled work routes introduced in the late 2020, which also includes skilled work healthcare, and also intra-company transfers, have been accounted for about 148,240. And these are about 62% of the total work-related visas that have been granted. And this make up about 98% of all skilled work grants in 2021. So there is no doubt that there have been an increase in applications through the healthcare visa. And the question is, how do you go about this? And I know some of our audience today are actually looking to go through that route. And with me today is Nurse Deo, who will be answering some of our questions. But I would like you to introduce yourself and tell us who you are, Nurse Deo. Thank you so much for joining us.
Hi everyone, my name is Deo Goodness. I am a registered nurse currently practicing here in the UK. I've been in the UK for about 3 years now, so I'm happy to answer questions and help us as much as I can.
Okay, thank you so much. And yes, so let's assume I'm an auxiliary nurse living outside the UK, living in a country like, say, Nigeria. How can I move to the UK without having to go to uni or apply for a study visa?
Okay, so at the moment, if you are not a registered nurse and you want to come into the UK, the government has introduced a new route called the care worker visa, which you can come in as someone who has basic knowledge of nursing, or someone who just has basically no background in healthcare at all can use this route to come. So it all depends on your employer. There are lots of employers that are willing to employ you from your home country down to the UK. So every employer has their own requirements. So some require you to have experience and some require you not to have any experience. So it all depends on which of the employer you're going with. If you do not require any experience, it's simple, just apply and hope for the best and get interviewed and come over here. But if you require experience, it's just for you to go into any of the private hospitals or teaching hospitals in Nigeria, even if it's just a clinic, to take care of people and have about 3 to 6 months experience, depending on your employer. Then some of them require to have a care certificate. It's called the 15 care certificate. You can do this simply online. Some of them, they are free, and some of them you have to pay like £10, £16. It depends on which website you use. And after getting all the courses, you can then apply for your interview, get interviewed, apply for your visa and come over here. And most of the times your employer is going to pay for almost everything, both your visa, your flight, your first few weeks accommodation. It depends on what's on your contract. So it's pretty just based on every employer will determine what you need. Some will require to have an English exam, some require not to, but at the end of the day, you need an English exam called the IELTS UKVI for your visa process. So whether you need it for your employer or not, you still need it to get a visa. So it's always advisable to just have it on ground, just in case your employer would need it. And the score, because we have 4 modules in IELTS. We have the listening, writing, speaking, and the reading. And for your UKVI visa application, you need a band of 4 in each module. So it's better to just aim above that, because some of the employers that will need you to have about 6, 5, or 7. No, they don't need 7. It's only nurses that need 7. So it just depends on what your employer needs. So basically, for your visa, you need a minimum of 4 in all modules to get your visa approved.
Okay, that's
yeah.
Okay, thank you so much for that. And I'm just thinking, because I know a friend who have actually done all the certifications, like all those online exams, has done IELTS and everything, but is struggling to actually get a job. I know the way you've said it, it looks like it's straightforward. And
yeah, of course, it's not straightforward.
You know, she has been applying, and right now she's frustrated because she did this police report and it's going to take 3 months, and in 3 months it's going to expire, and it's like she has to spend that amount of money all over again and everything. What advice would you give to that kind of person? What do you think might be our challenge, like maybe the difficulties that is actually maybe, and like an obstacle that is actually affecting her? What will make it easier for her to get a job? Let me put it that way.
So to be honest, it might be that there is no obstacle. Okay, so the UK is short of healthcare assistant. That is true. However, the fact that they don't need to have any license to be healthcare assistant means anybody, literally anyone, can be a carer. Anyone above 16, 17 can be a carer. So there are loads of people in the UK without their professional jobs that have been hopping on care jobs. Okay, so those people will be priority to those that are outside the UK. So it might not be that she has any issues with her application or anything. It's just that they will prefer people that are already here in the UK to you, who they will spend so much money on. And because you come here, most people have, these things started since earlier this year. Okay, it's not new. So the first set of people that came actually spoiled a lot of things for people as well. So most of them, once they come, they just work for a few days because to be honest, most of people that come do not even know what they are coming for. All they want to do is to migrate. They just want to leave Nigeria as much as possible. So they don't know that care job is not easy. Okay, so me as a nurse, I know care job is not easy. So if you are not even in the profession, starting off, it's going to be a huge blow on you, and not everybody can accommodate that. So they just tend to leave the work. So imagine someone spending so much money on you to bring you from your country, and in 1 week, 2 weeks, you said you're not working anymore. So it's their loss, it's their own loss. So at the end of the day, most employers have withdrawn from employed people that are outside the UK. Another thing is you need to apply to different places. Okay, you have to just try your luck. You need to apply for domiciliary care worker in the care home. You need to apply to NHS. You need to apply to living care, because there are so many care roles. It's not just hospital. Most people just apply to NHS, and NHS for even nurses do take time. So you have to apply to care homes, dom care, living carer, and every other like care locations you can find yourself in. Apply to different ones and make sure your application is like the UK format, like your CV is in the UK format. Also, what you can do is set alerts for job offers. So if you go on Indeed website, track job, NHS jobs, you will see places that you can put alert for your type of job. So if you set the filter, just make sure that you put care job, senior carer, or any other one you want to apply for, and they will alert you immediately there is a role, because most of these roles fill up quickly, and when it fills up quickly, they don't really, some employers will only take the interview the first 3 people, first 5 people, like that, and the rest people, they don't even look at your CV. So that's why you don't even get a reply from some of them, or otherwise they just send you, unfortunately, messages. So yeah, you need to just be quick and apply so many times. Some people, have seen people that apply 20 applications every day. So if you really want, I know people, I'm not saying the person has not tried so much, but you just have to keep trying. It's just basically luck and God's favor.
Yeah. So what you have said is the competition is very high right now, and you just have to keep trying. Okay. Yeah. I will hand over to Debola. Debola, your questions.
Well, I would like to ask how long it usually takes to get the visa.
So the visa process, it depends on you, how fast you can get all your documents ready, your employer as well, because your employer has to get what we call a certificate of sponsorship. So how fast your employer can get that for you, and also the type of visa you apply for, because we have priority visa, we have the standard visa. But if you get everything quick, you can be here in 3 months. Okay, so you can be here in 3 months. Or it, like I said, it depends on you, your employer, and what type of visa you apply for. but minimum of 3 months you should be here. Some people take like 6 months as well. It all depends on everybody's process.
Okay.
Yeah.
Debola, any other question?
You mentioned something about certificate of sponsorship. Like, how easy is it to get a sponsor for an healthcare visa? Is it just like they get sponsors all the time, or it usually takes a while to get sponsors?
There are sponsors everywhere. You just need to meet their requirements. Once you reach their requirement, they are going to sponsor you, because there's what we call A-rated sponsors. So most employers in the UK are A-rated. Like most NHS are A-rated. Most reputable care homes are A-rated. So once your employer is A-rated, they are eligible to apply for a COS for you from the Home Office. So that's just like a certificate saying they are the ones sponsoring you, and they have given you 2 or 3 years visa depending on your contract. And during that time, you'll be working for them, and the Home Office can then grant you a permit to stay in the UK.
And I
So
think just to add to what you've just said, there is a list in the UK websites of all the organizations, institutions, or care homes that sponsor you. So that's something, again, you can just download the list and probably just apply, as the spirit leads. So I think,
yeah.
Okay, now I will just handle. Omoyeni, can you ask your question, please, if you have any? Toby.
Thank you. Good afternoon, everybody.
Yeah.
Hi.
Okay. So recently, I've been working on trying to migrate through the healthcare route, but the issue I've been having is with the IELTS, whether to write or not. And someone has told me that Nigeria is exempted from the countries that is required to write IELTS. But then again, I saw a YouTube video saying that I must write the IELTS, UK VI IELTS, that I might not be able to register with the NMC, and I want to be sure how true that is. Although I've heard you say that you did the UK VI IELTS for the visa application. I just want to be certain if I heard right.
So are you coming in as a carer or as a nurse?
Yeah. No, as a carer, I'm not a nurse.
Okay. So like I said initially, you don't need IELTS if your employer does not require it. However, when you apply for your visa, you need a UK VI. So it's just like a UK visa immigration visa that you IELTS that you need, just a proof that you can speak English. So regardless of if your employer needs it or not, you still need a UK VI IELTS, except you can get an exemption later, which for me I feel it's just waste of time. If you can get an exemption later that you speak English, like your school can just write that and all that, but not everyone is successful. Not everyone is successful. So I'll just say, to be on the safe side, to save yourself time, just write the IELTS. It's just 4. Most people can get 4 without even practicing. Okay, so that's what I'll advise you.
Okay. That's all for now.
Okay.
Thank you.
Pelumi, do you have any question? You are muted. You are muted. Okay.
Can you hear me now?
Yes, we can.
Yeah, I can hear you.
So my question is, so far I don't think we've mentioned anything about the remuneration, like money. So what's the realistic price range of the salaries, and is this something that happens with? Is this something that goes along with promotions? I'm just trying to get knowledge about how prolific the pay is, because I've heard from different stories. I've heard some say, there is no really uniform amount that I've heard. So I would like to know that.
Okay, so when it comes to pay, like you said, you've not really heard any specific amount because it depends on your employer. Every employer will pay you how much they want to pay you, especially if it's not in the NHS. Like the NHS is like our government hospital, okay? Just like we have the state hospitals and all that. That's what we call the NHS here. So NHS NHS has a uniform pay. They pay people. So you see band 2, band 3, band 4, band 5, band 6, up to band 9. It's on their website. It's not hidden. It's there. However, if you go through the private, which is the private homes, nursing homes, living care, work, and all that, that's not regulated by the government. So they don't really have a uniform pay. But minimum wage here in the UK is it's about £9. So no employer is allowed by law to pay you less than £9. So yeah, less than £9. So you have to, they will tell you on your interview. So most of them will pay you. I know a carer that earn about £12, £14, £16. It depends on your location as well. So if you live in London, I don't think anybody will pay you less than £11 if you're in London as a carer. But then it's their own discretion, okay? Not anybody to tell. And another thing is you're allowed to work about 37.5 hours per week as a tier 2 worker. So after you've worked that, you can then pick up extra shifts, 20 hours per week, okay? So usually the 37.5 is about 3 long days in a week. Then in a month, you have to do 4 long days in a month. Every month, 1, but the rest is just 3 days in a week. Now, what most people do to be able to survive, because you can't really survive on your actual salary in the UK, that's just the truth, okay? So what most people do is to pick up extra shifts with agencies. And these agencies, as a carer, they can pay you up to 20 to 24 pounds per hour, okay? With these agencies. I have a YouTube video, like I'm a YouTuber, I'm a nurse, so I have a video about how you can get paid higher as a healthcare assistant as well on my YouTube channel. Probably you check that out and you see the agency. I think I'll just tell you, you can check Tumbri if you get here, they pay very well. Then there are other ones I can't remember, but if you check the channel, you see them. So you can then work 20 hours extra per week. So with that, you can even get more than you get with your regular job as an agency, so you could be able to balance up. And the pay, yes, it goes up. So with your experience, you can ask for a pay rise, and then you can apply if you've gotten some course, because there are some courses you can do that you can go up to senior carer, band 4. If you're in the NHS, you can move up the band. Then you can even get to a level they will train you to be a registered nurse. So if you are with the NHS, yeah, they can train you to be a registered nurse. But if you are with the care home, you can go up to senior carer, to team leader, and they have their own rank as well. But with NHS, there's more of progression. You can be a nurse in 3 to 4 years if you are fast.
Thank you.
Yeah.
And sorry, one more thing. Regarding the shifts, like what's the working conditions like? Is it like you work with a particular client or patient this week and then you move to another one the following week? There has to be a consistent pattern. Say you're with one patient for say a month. So I'm just curious about the working pattern, the work pattern rather. And is it like I'm sure any healthcare work requires shifts. So like how is it mostly done over there?
Okay, so when it comes to the kind of patients you have and the setting, it depends on which setting you are working in. So we have the acute setting, we have the community setting, and the living setting. So if you are working in the hospital, which is the acute setting where the patients are critically ill, you might be sending patients home every day. So you will not meet the same patient, you will not take care of one patient for more than 1 day. So it depends on which setting you are. If you're in the community, which is like mostly the care home setting, or going into their homes to take care of them and living, you can't be taking care of one patient or one resident, as they call them, resident for like the whole of the time you'll be there. So that's their home, that's where they stay. You go there, so you can take care of them for as much as they live till they pass out, okay? So you see them every day. But the living carer, I think that's the one you live with them, or they provide you accommodation very, very close to the house of the client, and you basically have the patient till your contract expires or till you decide to leave. For the shift pattern, it depends on which setting as well. For NHS, we have the like long days, so you start from 7 to 7:30, and they have the early shifts that start from 7 to 1:30. Then they have the late shift that start from 1:30 to 7:30. Then they have the long nights, which is from 7 to 7 in the morning. So, but some care homes start by 8 to 8. So it depends on the setting. But long days is 12-hour shift. You have 1 hour break. Then half day is 6 hours. You have 30 minutes break. Some organizations you work 9 to 5. Some you work 8 to 4. So it depends on which area of practice you are.
All right. Thank you.
Has that answered your question? Yeah, thank you so much for that. Yeah, thank you so much for that. For Akemi, do you have any question?
They've all asked my questions, so
okay.
Yes.
All right. So I would like to ask, what are the do's and don'ts when submitting an application to an employer, for example, by an healthcare worker? So in this case, I would say we should look at a potential support worker, somebody that doesn't have any, that is not a nurse, that is just wanting to be like a carer. Yes. What are the do's and don'ts?
I think the very first thing to do is to make sure you read on them, whichever employer you are going to apply for, read their requirements and try and make sure you meet up their requirements. Okay. It just makes you to be at par to be selected. However, some people have applied even when they don't have the requirement and they still take them. So it just depends on how many people applied for that role. You might not be qualified, but if they don't have any other person, they will take you. But as much as possible, meet the requirements and do not lie. I think one of the most important things is to be truthful as much as you can. If you don't have any experience, just tell them you don't have any experience. There's no point saying you have experience or going to look for somebody's CV and just copy everything you see because it looks good. And at the end of the day, even if you get here and all the things you said in your CV that you can do, you cannot do them, you might be sent back, you might be put in jail. So many things can happen, okay? Depends on your situation. So as much as possible, be truthful. If you can't do anything, they will always train you. In fact, even when you can do it, they will train you because they know you are not in the system, okay? But they still want, but if you don't know it, they will definitely know you don't have an idea. So there's no way you can lie and say you can do this. And when it's training time, you don't even know the name of anything at all. They will just spot on that you don't have any experience when you told them you did. So as much as possible, be truthful. And what else can I say about that? Yeah, I think basically that's the do's and don'ts. Even during your visa process, as much as possible, apply with, I don't know how to put it. As much as possible, do not forge any documents, even when you're applying, because I know people get forged documents of passports or police certificates. As much as possible, the UK has a way of finding out all these things. Even if you get here, it might be 5 years later, they will still find out because there's a rush on the visa and everybody's just a bit quick, do for me. Get this thing for me. Let me just apply. But as much as possible, come through the right way so that you will not have any issues when you are here.
Thank you so much. I would like to ask the final question, and that is, what has your experience been working as a nurse? Like most times people say like they're tired. Like I have people like they are nurse, elderly ones. Sometimes they say they're tired. The job is tasking. I even met somebody like this week, and the person was like, oh, they are short staffed. They have to work like 50-something hours, sometimes 60 hours. Not because sometimes some people want to because they need more money, but sometimes like the work is required and they're less staff and they're just kind of helping after they've done their own normal shift. So just tell me, how do you feel about the job itself?
To be honest, it's tiring, and it's like worse now, to be honest, because before COVID it wasn't this bad, and I feel like after COVID the effect of after COVID is worse on us now. Normally, nursing as a profession we are always short staffed, to be honest, but now like it's like times 10, and we get more patient than we should. We get more, the workload is just so heavy. So I would say it's tiring, but definitely it's still rewarding, and it's why we are here. It's our profession. We can't run away from it. So it's just what it is.
Okay, I just got a question from one of our audience, and she's like,
yeah,
when it comes to interviews, how should she like comport herself? What are the questions to look out for, like answering interviews, for job interviews? as a care worker?
With interviews, they will ask you basic things, to be honest. They won't ask you something you don't know. They will just ask you, sometimes they might ask you, tell us about yourself, just regular interview questions. Tell us about yourself, where have you worked, what level of education you have got. Then they can ask you, give you scenario-based questions. If you see a patient having seizures, what do you do? If you are taking care of a patient and they started having fits, like they can ask you different questions. They ask you how you manage a hard day at work, how you manage when a patient is shouting at you or being aggressive. They can ask you, how do you safeguard the patient? Like, you just have to go online and you see a lot of questions on interview. Every interview question will be different. So what I would say, just be open-minded and as much as possible, answer every question they ask you. You don't have to give spot-on answers. They don't really care about your answers. They just want to see willingness of you that you will be able to learn. At the end of the question, if you yourself, you know that you didn't answer the question well, you can just say, however, I'm willing to learn more about this and I'm ready to be trained more. You understand? So, because to be honest, you can't know everything when you're going for an interview. And some interviewers, they can be really tricky, asking you questions that you don't have idea. And they know you don't have the experience. If you're coming as a care worker, some of them already know. So they just ask you basic things you do. For example, if you're walking on the road and you see someone collapse, what do? They want to see you perform BLS, or they want you to just have the idea to say you're going to do chest compression, what they think everyone should know. If you see someone bleeding, what do? Like, if you go to a service user house and you find them unconscious, what do? They just want to see you say something. You can't just say, oh, you don't know, you don't have experience. No, they don't want that. As much as possible, answer. At the end of it, just say, I'm willing to learn. They are very happy with that. They will even assist you. They will even answer the question there. Honestly, interview in the UK is very easy. Most of them, they let you calm down. They don't force you or anything. So I think it's okay. Just answer every question. That's all I would say.
Yeah, thank you so much. I forgot to say that Nurse Deo also has a YouTube channel, and she has actually trashed some of these questions on her YouTube channel, and I'll add it to the description. Debola, do you have any concluding remarks for us?
Okay, yes, you mentioned something about being truthful and you shouldn't forge documents. I just feel like no matter how much you want to live where you are and get better opportunities, you should not let your desires to leave the country you are take the best of you, because you're actually going to deal with lives, other people's lives,
Exactly.
and then a little mistake could result into something bigger. So yes, please be truthful.
Thank you. That's true.
Yeah. Thank you so much for this opportunity to have this conversation with you and explore this topic with you, Nurse Deo. We're so very grateful. And yeah, if you want to know more about Nurse Deo, I think our YouTube channel is Nurse Deo, just that, right?
Yes,
if I'm correct. Yeah,
yeah.
Nurse Deo. And so I'm just putting it out to you. What are your thoughts? Any further questions? Have we been able to help you with some of your fears on this skilled worker visa? If you do leave a comment, remember to subscribe and definitely share with your friends who are also interested, and visit Nurse Deo's channel as well. And to come your way again, stay tuned and we'll hope to bring you more topics like this. All right, bye.
Thank you.
Yeah.